Larry Bird's other older brother, Joe Sardano, is the CEO of Sensus Healthcare.
Younger brother.
Younger. Ticker symbol SRTS. Back with us here on the Big Bish
We're going to
Show.
start covering SRTS on a regular basis.
Love it.
September.
This is really
Superficial radiotherapy. Actually, and I went and saw my skin guy.
Okay.
The skin guy, Dr. Mitch Goldman. Mitch Goldman, who I think invented it's called the snap laser tattoo or something, or I don't know. He invented a couple things. But I started talking to him about Joe and SRTS. He knew exactly what the company was. I'm connecting them two together.
Oh my God,
I see you mark it up 30% and give us a commission, Joe. What do you think?
Sounds good. All we have to do is bring back Dave Winfield to the Padres.
Oh,
and we'll be all
man,
set.
There you go.
There he goes. Hey, talk about, like we did last time, you know, the science obviously is impressive, and I want you to touch on that for a second, but then I want to talk about the real issue here. And the real issue is doctors aren't getting paid anymore. Dentists, I mean, I've got a doctor, his daughter, and who's talked to me about, boy, you know, it's all about insurance and Medicare and everything else. And it's not about, you know, it's not about going into that business when you take on you know, a new client or you take on a new patient. It's about what kind of insurance they have, you know, unless you're in the middle of the street and you have to heal them. But talk about that. Talk about both factors.
Well, you know, in the other domains of healthcare, the doctors have to work very, very hard in order to get paid. It's a lot easier with dermatology now that we've gotten CMS to provide us with those reimbursement codes, because most patients that have skin cancer are usually over 65, so they're in the Medicare, Medicaid range. And the third-party insurance companies, private insurance, they usually take on the same scope as Medicare, Medicaid. So everything is falling into line. The reports that we have working with our customers and the reimbursement that they're getting, they're seeing it happen very, very quickly. So it's not a difficult thing in order for the doctors to get paid. And like we've said before, there's a shortage of doctors treating these patients. There's a multitude of patients. If they open up their doors with SRT, they will have a lot of patients coming through their doors because, number one, they don't want the surgery. Number two, they're getting to know that it's paid for by Medicare, Medicaid. The doctors are happy, the patients are happier.
Hey, Joe, was I reading about SRT that there's just more accuracy also in in the procedure as opposed to the Mohs, or in addition to it, there's just more accuracy that you have, aside from just not wanting to be cut up. You have, the knowledge you're getting is greater about what your condition is.
Well, that's very, very true, because we invented IGSRT, which is image guidance. And so the Medicare, Medicaid people have allowed us to use imaging through ultrasound once during the procedure. So you could use it at the beginning or the end. And a lot of patients are paying for the option of having multiple ultrasound procedures. And it's a no big deal, because they want to know at the end of the procedure, is my lesion gone? And, you know, even when they do surgery, if they ask the doc, did you get it all? The doc's going to say, yeah, I got it all. Okay, show me. Well, I got it all.
Wow.
Prove it. You know, so imaging is a picture is worth 1,000 words. So an ultrasound image at the end of the procedure, at the end of the protocol, is going to clearly indicate to the patients that their cancer is gone. And so that's one of the biggest assets that we have using SRT.
Hey, Joe, talk about, you know, we always talk about dermatology. Talk about other growth opportunities like oncology and other healthcare points.
Well, we're starting to see a lot of movement in the radiation oncology world, especially in the hospital market. And as a matter of fact, to recognize that, CMS has recently proposed a 25% increase in the treatment codes for hospital-based units. So we've seen an increase in installations in the hospital base relatively over the past 3 or 4 years. And we're starting to see a much wider interest for these hospitals in purchasing this, because there's really nothing else that they have in their repertoire of equipment that can treat skin cancer the way SRT can. So we're hoping that this progresses and continues to grow, and the hospitals are going to have a good, solid dermatology program for the patients in the future.
Joe Sardano, the CEO of Sensus Healthcare, ticker symbol SRTS, with us here on the Big Bish Show. Joe, as far as the physical learning of the technology, I mean, how quickly, if once you get into a dermatologist's office, does it take the staff and the doctor, his or her, to learn it and then start treating people?
Yeah, whether it's a fellow or even an assistant.
Yeah.
Yeah, it's a good question because in many of the states, the physicians are allowed to use extenders. They're allowed to use their nurse practitioners or PAs
Okay.
or an RTT, a radiation technologist, to push those buttons along with the doctor. And what we do is when we install a system, it's usually ready to go on a Monday morning. We'll have them bring their patients, their initial patients for treatment, and we'll have our clinical people there training the entire staff on using the SRT machine. And we're there for about a day and a half to 2 days training them. And after that, they're on their own. It's a
Wow.
very, very simplistic procedure to use. It's a heck of a lot easier to learn than it is to do surgery.
Sure.
You know, one thing we don't talk about much, and your background obviously is 30 years in management and marketing, and you got a great history in introducing and commercializing new technology. Talk about the rest of your team, and talk about part of the governance and the U.S. expansion that you guys are planning, because I know a big piece of this is scaling, right?
Yeah, well, I'm very proud of our team because it's really a homegrown team. It's people that started with us 16 years ago that really didn't have the background of healthcare that a lot of the bigger companies would be looking for. We wanted very smart, aggressive, hardworking people, and these people have rewarded us by working the last 10, 12, 13, 14 years with the company, progressing to points where homegrown person is our chief operating officer. Homegrown person is our chief technical officer. Our VP of sales has been with the company for over 10 years. Other people in our sales department have been with us as much as 14 years. And just to give you a little background of how diverse the company is, we've had a routine or a tradition where about a week before Thanksgiving, we bring everybody together to bring a recipe that they remember eating at home, either their grandmothers, their mothers, whatever country they came from. We have 16 countries represented just in our headquarters office where we have about 30 people. That's huge. And so we're very proud of the fact that we're multilingual, we come from multiple backgrounds, we all get along, and everybody works together, regardless of what their own home situation is. But it's a very, very good company to work with, and we work very cohesively together.
Hey, Joe, last question, at least for now. What's the next 6 months look like? Believe it or not, we got, 5 months, 5 or 6 months left in the year. What's the next 6 months, then what's the next 18 months look like in your mind? So much.
Well, I've been saying it for the last several months since the beginning of the year that we're seeing the second half of the year is going to be a whole lot better than the first. We've got a lot of momentum building up because of the change in the reimbursement, training and educating the doctors as well as the patients. So that's coming to a fruition. If we're looking 18 months in advance, I see us with some kind of a hockey stick event happening in 2027. And I think that the outlook for the company is very, very good. We're only going to be selling more machines. We're only going to be placing more machines in the market because more patients are going to require this procedure.
Joe Sardano, CEO, Sensus Healthcare, SRTS, no Mo's procedures. SRTS is the way to go. No Mo's.